Hi, everybody. I want to give a welcome to everyone who's joining us for this Google Hangout. And I'd like to introduce each one of our panelists. First, my name is Yándary with Voto Latino, and I'll be moderating today. So I'll just start from left to right. On the left, we have Christina Postolowski from Young Invincibles. Thanks, Christina. Christina is a senior policy analyst with Young Invincibles. She focuses on higher education and healthcare policy. She has legal and policy experience in immigration and women's rights, and was co-president of the Georgetown chapter of Law Students for Reproductive Justice. One of her successes there is they succeeded in ensuring that all student health plans would cover women's preventive services under the Affordable Care Act. Christina is also a 2012 graduate of Georgetown Law School, and we're happy to have her join us today. Next is Jennifer Nandu from NCLR. Jen is the director of NCLR's Health and Civil Rights Policy Project, which aims to improve the health status and outcomes of Latinos through policy change. Jen sits on the Board of Directors and Council of Consumers for the National Physicians Alliance, and she's the Vice President on the Board of Directors of the Herndon Alliance. In 2012, she was also appointed by the government of Mexico to serve on the advisory board of Ventanillas de Salud, which is a program that works to promote preventive health access for Mexican nationals in the U.S. Jen has a degree in psychology from Duke University, and she's from Zambia and grew up in southeastern Connecticut. Next, we have Jose Plaza. Jose is the National Director of Latino Engagement with Enroll America. Enroll America is the national nonprofit whose mission is to maximize the number of uninsured Americans who enroll in health coverage available through the Affordable Care Act. He's in charge with making sure that disenfranchised and uninsured Latinos are engaged through national partnerships, outreach, and coalitions, and ultimately making sure that they enroll in health plans. He's currently a doctoral candidate at the University of Southern California and has a master's in counseling from CSU Long Beach and a BA from San Diego State University. Our next panelist is Dr. Kenny Lin. Dr. Lin is director of Georgetown's Primary Care Health Policy Fellowship and Associate Deputy Editor of the medical journal American Family Physician. He is a graduate of Harvard University and New York University School of Medicine and completed his family medicine residency at Lancaster General Hospital. He also did a fellowship in medical editing and faculty development at Georgetown School of Medicine. He's a former health blogger for U.S. News and World Report, and he shares his views on health and health policy on his blog, Common Sense Family Doctor. And we're also joined today by Dr. Elena Rios. Dr. Rios is she's the president and CEO of the National Hispanic Medical Association, which represents Hispanic physicians in the U.S. and works to improve the health of Hispanics. She's also the president of the National Hispanic Health Foundation and serves on the National Hispanic Leadership Agenda, Campaign Against Obesity, Care First Blue Cross Blue Shield, Commission to End Health Disparities, and the Nurse Family Partnership Boards of Directors. Dr. Rios earned her BA from Stanford University and her master's and MD degrees from UCLA. She was also presented with an honorary Doctor of Science by Lehman College in 2010. So those are our panelists, and as you can tell, we have a really good group of experts with us today to answer our questions. So we'll just get started. First, I want to thank all of you who submitted questions to us on social media and a lot of you who submitted on text message. And so let's just get started. So just to start off with a general question, what is the Affordable Care Act? This is the main topic of today, and so we'll give a chance for our panelists to give us their summary of what the law is.
I'll just jump in. The importance of the health insurance law or Affordable Care Act is that all people in the United States that are qualified would be able to buy health insurance at more affordable prices through a series of health insurance options, one being for people that are of low income called Medicaid, and one for children called CHIP, one for elderly people or people that are blind or have renal disease, and that is called Medicare. And the newest option is to take private health insurance plans and put them into marketplaces in each state called the Healthcare Exchange, or now called the Healthcare Marketplace. So that is, in a nutshell, what the Affordable Care Act means for access to affordable care through health insurance. Now, there's a lot of other pieces to the Affordable Care Act, but I think we just wanted to focus on that because October 1st was the first day of enrollment for this new system of health insurance options.
Great. Does anyone else have something to add from our panel?
I think to add to what Dr. Rios said, there are a lot of other pieces, and I think one that is relevant to today is that the Affordable Care Act isn't only about getting people covered, it's also about improving the quality of medical care that you receive. Could you hear me?
No.
Okay. Okay. Dr. Elena, are you there?
Yeah, I'm here. Did you want me to repeat myself? Was I muted?
Yes.
Okay.
Okay, perfect. Thank you so much. Okay, let's move on to the next question. This one came online, and the question is, where and when can I look for affordable insurance?
I just saw my name there. October 1st. Oh, sorry. October 1st to March 31st is the open enrollment period for the affordable health insurance through the marketplaces. And the first place everyone should look, if you have online access, is the website called www.healthcare.gov. The healthcare.gov then sends you to a state marketplace for those states that have their own marketplace. For those states who have opted not to have their own marketplace, the healthcare.gov is your online marketplace. There is also a phone number to call to have access to the same information, and that phone number is 1-800-318-2596.
This is Jennifer. I'll just add a few things about key deadlines and dates to keep in mind. October 1st through the March 31st is of course, the open enrollment period for people to enroll in the marketplaces. But there's a few other things that you should think about. One is that if you want your coverage to begin on January 1st, you should window shop now, but you should make sure that you enroll by December 15th. Secondly, if you want to make sure that you don't have any chances of being subject to the fines for not purchasing insurance, you must make sure you're enrolled by February 15th. So those are key dates to think about. You have a long time to sort of look around and make sure that you're getting the best plan that's for you, but keep those dates in mind.
Also, for those that are Latino or Spanish speaker, you can also go to cuidadodesalud.gov, which is going to be launching in a couple weeks. You can also look out in your communities for navigators or personal assisters, in-person assisters, as well as certified applications counselors. Those are in-person assisters that will help you navigate through the application. Also, you can go to ayudalocal.cuidadodesalud.gov, and that one will help you locate personal assisters and navigators within your area.
And one thing I wanted to add, I'm not sure if everybody heard Dr. Lin talking about it. So a lot of people who've shopped for insurance before who have a pre-existing condition may have found that they were denied coverage or asked to pay more for coverage and it wasn't affordable for them. That's actually something that's changing with the new healthcare reform law. So you can go to the marketplace and shop for a plan and you don't have to worry anymore that you or a family member are going to be denied coverage because you have a chronic condition.
Wonderful, thank you so much. Jose from Enroll America, just a quick follow-up question for you. Can you share a little bit about the navigators and how they provide a resource to folks looking for health insurance?
Sure. So navigators come in two different ways. They are either organizations or individuals that are trained and also funded by federal grants. And they are throughout the states. Different states got a multiple of grants to actually work with our community members. And so be it with us or with any of the partners, we're working hand in hand with the navigators. They should be unbiased. They better be. They will not be charging you. It is a free service provided by the government. And they are there to help you navigate as you apply or also with in-paper application, in-person application. So definitely look out for them. We do have a list of them on the website on getcoveredamerica.org if you want to look at the different resources and where you can go find one. And again, go to the HHS website as well as the Spanish one, cuidadodesalud.gov to get those resources.
Perfect. Thank you so much, Jose. And I just wanted to repeat the phone number Dr. Rios mentioned. It's a great resource for anyone looking for help in over 150 languages. That phone number is 1-800-318-2596. Again, it's 1-800-318-2596. Moving on to our next question. What types of health plans are available on the health insurance marketplace?
So I can start off and other folks can jump in if they'd like. There are actually going to be 5 different kinds of plans available on the marketplace. One thing to note just at the outset is that these are all plans offered by private insurers. So insurers you may be familiar with, you may have been covered on a plan before. But they're sold through this new marketplace that's going to make it easier to shop for plans and compare how much they cost and what benefits they cover. All the plans on the marketplace also have to meet certain standards in terms of what they're covering, how much of the money you pay is going to paying for your health care services. But there are 4 types of plans that are called metal level plans. So those are bronze, silver, gold, and platinum. And they basically correspond with how much money you're going to pay per month for that plan, and then what percentage of your health care that plan covers, so your doctor's visits or your prescriptions. So the bronze plans are going to have a lower monthly cost, but a higher deductible, so that means you could be paying more out of pocket for things like doctor's visits, but you're going to pay less month to month. And then platinums are on the opposite end. They're going to cost more each month, but you're going to have to pay a lot less for services. And then the 5th type of plan is called a catastrophic plan, and that's targeted at young people under 30 or people who can't find other options for coverage that are affordable, which means cost less than 8% of your income. So those plans may have the lowest premiums, but they're going to likely have the highest deductibles. It's good if you're healthy, you don't think you're going to have a lot of healthcare costs, but you should know that you could end up paying a lot out of pocket with those plans.
Great, thank you. Do any of our other panelists have anything to add for that question?
Well, I guess on my end, I just really want to encourage people to actually visit the website, get familiar with it. I know there's been some glitches, but as it was mentioned, you should go on the website. Shop around. It really is that. Shop around to look for the best plans, what suits you and your family, and really find out, with your income levels, what is the best plan for you.
Wonderful. Thank you. Our next question we've already covered, but I'm going to ask it again because there might be some of our viewers tuning in a little bit later, and this is important information for them to have. So question number 4, once I sign up for a plan on the health insurance marketplace, when can I start using it?
I'll take a stab at that. This is Jen again. It depends on when you decide to enroll. So there's a few key things to remember. First, if you want a plan over this next year of coverage, then you must enroll by March, the end of March 2014. Beyond that, if you want to have coverage by January 1st, you should be enrolled by December 15th. If you want to take a little bit more time to shop, you can enroll after that between January and March, and your coverage will essentially start the subsequent month after you enroll. So, you know, the key date is December 15th. Make sure that you're shopping around and looking into coverage for January 1st. So anybody who enrolls today, January 1st is the start date.
Thank you, Jen. And a follow-up question, what happens if someone misses the open enrollment period?
Well, the open enrollment period, which is pretty long, it won't be as long as it is now in future years. So take advantage of that long enrollment period. But if someone misses the enrollment date, they will not be able to purchase insurance during that year, and they'll have to wait until the next year for the open enrollment period to begin. So that is big. And then for certain people, they will be subject to that personal responsibility requirement and may be subject to a fine because they did not purchase insurance. There will be some people exempt from that, usually due to financial circumstances, but there will be some people for failure to purchase insurance who will be subject to a fine.
There is an exception that. Oh. Sorry, can I?
Go ahead.
There is an exception if you have, an unexpected, a critical illness. There is an exception in the law, and it is on the website that you can enroll for insurance after March 30th, but it has to be a dire circumstance. And Jennifer's right. You really do need to think ahead and start getting used to the concept of open enrollment. So in 2014, the open enrollment will be less time, will only be from October to December 15th for the following year, 2015. So this year's a real opportunity to get more people to know that in order to get involved in insurance, you've got to start shopping around during the open enrollment season, which this year is from October 1 until next March 31st of 2014.
There are also exceptions for qualifying life events. So if you have insurance through your job and you lose your job next June, then you can still then you can go into the exchanges then. Or if you have a baby next June and the baby wasn't insured on your plan, the baby can be added to your plan. Or if you get married, but those are kinds of things that in most open enrollments are considered exceptions to open enrollment periods.
Thank you so much to all of you for answering that. That was a little bit of a tricky one, but I appreciate it. So now that we have a little bit of a general overview of the Affordable Care Act, let's get into a little bit more specific questions from our audience. Someone submitted this question and said, I'm currently a college student. What options do I have for health insurance under the Affordable Care Act?
I'll take that one to start off. So college students actually have more options than they've ever had before, thanks to the healthcare reform law. Since 2010, young adults under age 26 have been able to join a parent's plan if their parent has insurance that offers dependent coverage. And that doesn't matter whether the young person's a student, whether they're married, or even whether they live in the same state as their parent. So you have that option of getting covered on a parent's plan. A lot of schools also offer student health insurance plans, and that's another way you can get covered. And the Affordable Care Act makes student health insurance plans better. They now have to cover things like preventive services without a copay. Those are things like depression screenings, your well woman visits, and contraception. and they can't deny you starting in 2014 if you have a pre-existing condition. You can also go and buy a plan on the marketplace. Student plans are considered individual plans, not employer plans, so you are free to shop on the individual market or through the new marketplace for coverage. If you're independent, tax independent, you may be eligible for tax credits to help lower the cost of buying a plan on the marketplace. If you're tax dependent, you can talk to your parents and enroll in a family plan, and your family might be eligible for tax credits to lower the cost of buying coverage.
Thank you. Does anyone else have anything to add on that one? Nope. Okay, we'll move on. The next question. I have health insurance available through my employer, but it's very expensive. Would I qualify for insurance under the new program?
I'll start. The marketplace is available to all individuals that think that their employer plans are too expensive for them. That was the whole point of having an affordable place to shop, where certain insurance companies that are private have already been qualified by the states or by CMS, by the federal government, to offer their health insurance. So the answer is yes, that you could move from an employer plan and stop that and move into a marketplace for health insurance.
The one thing that I want to add to that, though, is before going to the marketplace, you will have to do a number of different things. One is you are subject to an affordability test that you'll work with through your employer. There's an employer coverage tool that's also available at healthcare.gov or cuidadodesalud.gov, and that tool basically will work with you on your income as an individual to see whether the plan that's offered to you is affordable. That's based on a basic about 9.5% of your income. So if your health insurance plan costs less than 9.5% of your income, chances are that means that you're not eligible to go into the marketplace. The only other thing to note about that is that's for your individual insurance alone. It is not based on the cost of family-based or a larger group of people getting insurance that you're covering.
So what you're saying, Jen, is that so this person who submitted the question, if he or she are trying to get insurance through the health marketplace, then he or she would have to talk to their employer first or go to the website first?
Right, because your employer, well, they can go to the website first, but ultimately you will have to work with your employer to, and so you might as well go to your employer first and make sure that you're working through that employer coverage tool to make sure that the affordability works out for you to go into the marketplace.
Got it. Thank you. Okay, our next question. This is a pretty interesting question. So this person says, I'm young and healthy. Why should I get health insurance? Wouldn't it be cheaper for me to just pay the fine?
I'll start. I won't put Young Invincibles on the spot. You know, I guess it's just, you know, the saying that I always say is don't play a game of chicken with your health. You may be young and healthy today, but you could have a very serious incident the next day. And so it's really important to invest in health insurance that makes sure that you are covered when you need health care the most. I'll use myself as an example. A year ago, doing everything absolutely right, I was walking across the street and hit by a car. I could have never predicted that that would have happened, and luckily I had the insurance to make sure that my health care expenses didn't explode. But beyond that, I think you know, this is an investment over the long term, and the plans that are offered through the marketplaces in particular have very strong access to preventive services that can help you with the types of screenings and health care that you need. And that's anything from cervical cancer screenings to just well visits, and even plans have access to free birth control. And so I think that there's really important parts of your life as a young person who's healthy that you're going to gain access to many great benefits through the Affordable Care Act and the plans that are available through these marketplaces.
Thanks, Jen. I was talking with my dad about this recently, and his comparison was to a car. He's like, we change our oil, we rotate our tires. Why wouldn't we do that for ourselves? So thank you so much. Christina,
and I'd like to remind folk that if you're under 26, you can be covered under your parents' insurance. So that's also another option that will facilitate cost. And preparation is key, so it's better to be well prepared just in case something does happen, and it usually does. So get prepared.
Right.
And I can say from the perspective of a doctor, and most of my patients are between the ages of 20 and 40, and an impressive number of them run up a lot of medical expenses. So it's not something that just strikes only a few people. It can happen whenever you least expect it.
Yeah, I was just going to agree wholeheartedly with the other experts on the panel. You know, and one thing Young Invincibles has found in our polling is that young people do really value health insurance coverage and want it overwhelmingly when they can afford it. And that's one of the great things about the new healthcare law. Right now, for example, there are 19 million uninsured 18 to 34-year-olds. Up to 17 million of those young people could qualify for tax credits to get a lower price on buying a plan on the marketplace, or Medicaid if all states were to expand. So if you're a young person out there thinking about insurance and thinking that it's still going to be out of your reach financially, I would just encourage you to go to healthcare.gov, Cuidado de Salud, and check it out and see what your options are.
Thank you, everyone. Moving on to the next question. This is one that actually came in from a couple of people. The wording was a little different, but the concept was the same. What kind of insurance would I qualify for if I have no income or am currently on unemployment?
So it's possible in that case, depending on what state you live in, that you might qualify for Medicaid, which is the state and federal cooperative program to provide health insurance. That's different from the exchanges. However, if you go onto the exchange website and input your income information, they should guide you toward that. If you're eligible for Medicaid, they may take you out of that particular and say you need to sign up for Medicaid. So that's one possibility, but it does depend on the state you live in, because some states took advantage of the healthcare law's provision to increase eligibility for Medicaid, and some states did not. So it kind of does depend where you live and what your income level is, whether you qualify.
Thank you so much, Dr. Lin. Our next question actually kind of ties directly to that. It's, what is expanded Medicaid?
The expanded Medicaid, as Dr. Lin just mentioned, is really the state and federal government's cooperative insurance program that is offered right now to a certain level of income. And with the Affordable Care Act, it was decided to expand that level of federal poverty level for eligibility. So there's more people available to or eligible to apply for Medicaid now, but the states had to say, yes, I do want to expand my Medicaid population. So the expansion of Medicaid is only in those states that agreed to increase their level of poor people that would be eligible up to, I believe, 138% of poverty. Mm-hmm. And I'm not sure what exactly that number, the income level. Does anybody on the line want to say the income level for individuals?
It's about $15,800 for an individual, and about $45,000 for a family of four.
Okay, so that's good. And I'm sorry, I just am blanking on that one. But the $15,000 for individuals, I mean, for young people who are just getting out of school, out of high school, out of college, some people working minimum wage, that's all they're making. So you could qualify for Medicaid in those states that decided to expand. And if for those states that did expand, they're getting 100% of reimbursement from the federal government. So it was a really good deal that some other states decided to not to get, mainly because of political reasons. But we're very interested in letting people know that Medicaid's a good thing because it also will have access to health care services, medications, and other services that Jen mentioned for health care.
Thank you so much. Our next question is related as well. It's what will happen to the people who qualify for expanded Medicaid but who live in states that didn't take federal funds to expand the program locally?
Okay, well, the major issue is that there will be a lot of people who could have qualified for Medicaid who will now have to go and find care coverage through the marketplace as individuals and see if they can afford it through those marketplaces. And go through what we've already talked about, the healthcare.gov or the cuidadodesalud.gov or the phone number. But in addition, for people that would have been on Medicaid, in other words, they are the low income in our communities, you can go to community health centers. Our federal qualified community health centers are great places of care for people who need extra help because they have sliding fee scales or in some cases are free. We want to encourage people not to go to emergency rooms. There are lots of doctors in our communities too that offer sliding fee scales or cash. So there are other options to Medicaid, but you should try to get insurance. And then there is that catastrophic plan again for those that are less than 30 years old or who have limited incomes. To consider as a kind of a last resort because it will be high deductibles, but at least you'd have some coverage if you had an accident.
So I just wanted to add a couple things to what Dr. Rios has said as well. If you're in a state that decided not to expand Medicaid and you would have qualified had your state expanded, you will be exempt from the fine if you are not able to find or afford coverage. So you're not going to be penalized if your state doesn't expand. Unfortunately, if you can't afford a catastrophic plan, you may be left without an affordable option. Luckily, there are community health centers that can be a great resource. Just a little bit also about the mechanics of going on the marketplace because some people have been surprised. In states that don't expand, if you make more than 100% of the poverty level, which is around $11,000 for an individual, you could be eligible for tax credits to help lower the cost of a plan. If you make less than 100%, you're not eligible for those tax credits. Which doesn't make sense and seems backwards, but it's because those people were supposed to be covered by Medicaid, but their states are not expanding the program. So it's really unfortunate in the states that aren't expanding that some of the poorest people could be left without coverage. And I know that's something Young Invincibles is going to be working on in the coming year, and a lot of other organizations are going to be working on changing so that everyone has access to care.
And just real quick, I wanted to highlight the idea that the federal government has expanded funding for community health centers. So if, unfortunately, you do happen to be in that bracket that does not get insurance, definitely community health centers and a lot of our medical care partners can still offer coverage if you're not qualified. So the federal government is expanding funding for that.
Thank you. And so a lot of you have mentioned the community health centers. Where would someone go to find a clinic or a health center in their local community? Is there a website, or what are the resources for finding those?
It is the same website, healthcare.gov. Will take you, if you look under community health, it will take you right away to the HRSA, which is the Health Resources and Services Administration online linkage for the community health centers. They're federal qualified health centers, and they're all listed there by state and by zip code.
Thank you so much, Dr. Rios. Our next question comes from someone who says, I'm currently on Medicare. Can I choose a health insurance plan from the online marketplace instead of Medicare?
I'll jump in. The answer is no. If you're qualified for Medicare, that is a federal government insurance, and so there's no reason why you would want to get another insurance unless you wanted a long-term care insurance, for example, for nursing home care. So no, the marketplace are for those people under 65 years old or who are not on Medicare and who are not eligible to apply for Medicaid or CHIP in the Children's Health Insurance Program in their states.
The one thing that I will note about changes to Medicare that I think is important to keep in mind is that there's been more than 72 different preventive services that have been declared free of charge under Medicare, similar to the health insurance plans. So we're really aligning health insurance plans. Actually, several years ago, after the Affordable Care Act passed, it allowed seniors to be able to get a comprehensive, essentially, analysis that was proactive. So looking at what care was needed moving forward as opposed to going in when you're sick, so moving from sick care to health care. And then 3, over time, the donut hole related to Medicare prescription drug Part D coverage is going to be completely closed. Millions of seniors have already received rebates in smaller amounts when they reach the donut hole, but that is eventually going to be closed entirely so that no one has a gap in their prescription drug coverage. Excuse me.
And I think I wanted to highlight real quick. Obviously, we're going to have a lot more young people online right now, but this is key in order for our parents and our grandparents that don't have access sometimes to a lot of this information. If they're already under these services, you need to let them know that they really don't have to do anything if they're under Medicaid, under one of the states that already has expanded coverage. They simply have to stay on the plan and take advantage of the added benefits. But that's a big confusion with our parents and grandparents, that they're wondering if they have to do something completely different. But if you're in a state like California or New York, you really don't have to. You're already covered under Medicare, so stay on the plan.
Thank you so much for answering that. Everyone's feedback has been really great. The next one is a pretty important concern that a few people have raised. The question is, I'm worried that my health insurance will be more expensive under the new law. What are some of the reasons this could happen?
So I'll try to take that one. I mean, it depends on your individual circumstances, but there are many possible reasons that your health insurance cost may have gone up. So kind of the flip side of the ACA kind of making insurances provide more benefits and provide sort of unlimited coverage, in that they're you can no longer say, oh, we'll cover you up to $100,000, and once it passes that, you're on your own. You can't do that anymore. You also can't exclude certain classes of services. You can't sell policies without maternity care, for example. And of course, as people have mentioned, there are a number of preventive services that may not have been covered before that are now included. But all of those cost extra money. So in some cases, plan prices may increase because just providing all those extra services will cost a little bit more money. Now, for the individual, it's hard to say, because someone in the income bracket that the insurance exchanges are targeted as may be eligible for subsidies which offset that. So it may be that your policy may cost more sort of in a pure way, but then you're eligible for discounts that really lower your payment to below what it might be. But it will vary depending on how much money you make and what type of plan you're looking at.
The other reason that a lot of people are afraid that the premiums will be going up, but is because people that are going to start looking at insurance may be sicker than those who are not getting insurance right away. And we're hoping that young people especially start thinking of investing in health insurance so that we can kind of balance it out in our populations in our society, that we do have a more even or a more balanced reaction, I guess, is the way to say it. That and luckily, I think it's been great to see the reports coming out of California, New York, and other states where the insurance companies that are on the marketplaces have really done, I think, great jobs of decreasing their premium effect or impact that Dr. Lynn's referring to. And we're seeing surprisingly lower insurance costs than would have been expected if we continue to, we've seen higher insurance through the years. It's kind of coming down a little bit, I think, to get people to start getting into the system.
Thank you so much to both of you. Question number 13, is dental care covered by Obamacare? What about eye exams?
So this is Jen. I'll just say that dental and vision care are generally not covered under adult plans, but those dental care in particular was included in children's plans.
With respect to vision care, regular sort of eye exam checkups for when you don't really have a problem are not generally covered. But if you are older and you have, certain eye diseases like glaucoma, for example, those are generally covered under regular health insurance.
Okay, thank you very much. Question number 14. I'm a healthy young person with no pre-existing conditions. I've never had to make healthcare decisions on my own before because I've been on my parents' plans. What should I be looking for when I'm comparing health plans on the online marketplace?
So one thing you can start with is just getting some basic knowledge about health insurance. What is a premium? What is a deductible? What's that going to mean for you? Healthcare.gov has a glossary of terms and also has a lot of different pages explaining different aspects of the law. If you're younger and healthier, you might want to think about how much you can afford, both month to month, and how much you're willing to pay out of pocket. In terms of benefits, if you have a chronic condition or need a certain prescription, or just want to make sure for your own peace of mind that something is covered, you're going to want to look at the detailed benefits in each plan before you buy one. All plans on the marketplace now have to cover 10 categories of what are called essential health benefits that include things like maternity care, prescriptions, habilitative care, but the specific services in each plan in each of those 10 categories might be a little different. So if you know that you need services in mental health, you're going to want to look at the plans carefully to make sure that the services you need are covered.
I'd also add that if you have a particular doctor in mind, or if there's a hospital that if you needed to go to a hospital you especially want to go to, make sure that they're covered by the plan you're looking at, because the least expensive plan might send you 50 miles to some other place or might not include the doctor that you want to see. And I always encourage patients to call the doctors directly to find out whether they're still taking that insurance, because often the information that the insurance company will provide you may be outdated.
And when all else fails, I would say make sure that you remember that you do have the resources of patient navigators within your community, as well as the 800 number and the two websites, healthcare.gov and cuidadodesalud.gov.
Great, thank you so much. That was a really great question, and I appreciate the answers for those who are listening. The next couple questions deal a little bit with immigration and the Affordable Care Act. So question number 15, can individuals who qualify for deferred action or DACA get health insurance under the new regulations?
I can take that one. Well, one of the main regulations of ACA is that you do have to be a U.S. citizen or legal permanent resident for more than 5 years. Unfortunately, there are some limitations, and also depending on the country you come from in terms of asylum. There are about 15 to 20 different categories in terms of the qualification, but DACA students or dreamers do not qualify. Unfortunately, there's also like I said, some limitations around legal permanent residence, but you do have to be a U.S. citizen in order to qualify. If you are coming from a mixed status family where either your parents or your children or siblings are undocumented or in the process of applying, we are encouraging folks that they do go online, sign up for those that are eligible, because at the end of the day, you want to make sure that everyone is able to enroll and take advantage. And you do have to be lawfully present as well. Christina just gave me a note on the side.
Yeah, I'll just clarify the rules around this. One, you have to be U.S. citizen or lawfully present to be able to have access to the marketplaces. Again, those statuses are on healthcare.gov and Cuidado de Salud, so you can actually see. And that's really important because you also have the personal responsibility to purchase insurance if you are lawfully present or U.S. citizen. If you under Medicaid, you also have to be a legal permanent residency with a minimum of 5 years of residency. So I think that's where some of the confusion comes in.
And also, again, for those that do not qualify, again, we want to be sure to highlight the fact that there are community clinics that don't have legal restrictions, so you can still find emergency care through these healthcare community clinics. So definitely, you're not out completely in the cold in terms of healthcare coverage when it comes to emergencies if you happen to be undocumented or a DACA application person or a dreamer. So there are still resources out there for you.
Thank you so much, everyone. The next question ties into that one. It says, some of my family members are U.S. citizens and some are not. How can a family like ours, which is what Jose was referring to, a mixed status family, how can a family like ours figure out how to get health insurance?
So let me just take a stab at that really quickly. I think Jose made a really important point, which is not only are the lawfully present or U.S. citizen individuals in your family qualified to purchase some types of insurance, they have the personal responsibility to do so. If you, for instance, are a parent who does not have an authorized status, you can apply on behalf of someone who is lawfully present in your family, which means that you're not applying for yourself, but you're saying, I'm going to make sure that this person can submit their application. And that means this information can only be used for enrollment purposes, and people who are working with you in the enrollment process must protect your privacy and work with you through the enrollment process while respecting that privacy. You can go to healthcare.gov and Cuidado de Salud, as well as the 800 number, which I don't have in front of me, but you can work through those eligibility questions with someone at those sites before you even go and apply, so you have an understanding of what they are. And then for many, I know that your community-based organizations are your trusted within your community, and they are the ones that you're going to want to reach out to, including community health centers to help you figure out, and patient navigators to help you figure out this eligibility process.
And then for those that do happen to have folk that are undocumented in their family, the information collected cannot be used against you in terms of immigration purposes. They are not connected, so you don't have to be scared that if one of your family members is undocumented and you get insurance under the plan, that there will be repercussions against your family.
Thank you so much. Okay, the next question, does the Affordable Care Act apply to Puerto Rico? If so, how?
So it's a mixed bag for Puerto Rico, right? There are a lot of really great things about the Affordable Care Act that do apply. So, for instance, all the consumer protections that we've been mentioning, including things like children getting coverage on their parents' plans, no lifetime caps, no annual caps, consumer protections that ensure that, for instance, insurance companies pay 80 cents on every dollar that you pay out of pocket has to go towards health care. All of those things do apply. And so, for instance, in Puerto Rico, I think last year about 56,000 people got rebates because their insurance companies didn't pay 80 cents on the dollar. On the other hand, since Puerto Ricans who are living on the island do not pay federal taxes, they are not subject to the personal responsibility to purchase insurance. And then the main functions, the things like marketplaces, worked very differently. So Puerto Rico received $1 million in planning to think about how they were going to use their dollars for Mi Salud and their healthcare system. And what they ended up the end of the day, what they decided to do was not to create a health marketplace or exchange like it looks in the United States, in the continental United States, but to do something very differently and add all of the money that they received, which is almost $1 billion, to their Medicaid program. And what that does is make sure that people who are living on the island can enroll in the Medicaid program. More people can, including they estimate that there will be like 76,000 in this first year. It'll be added, the $1 billion will be added to a larger pot, and $600 million annually would go towards that. The second thing that they do, that will generate a lot of savings for the island, and what they'll do with that is they're going to create a private marketplace that's a little bit smaller, with $61 million saved to offer bronze plans that are subsidized, which means they're basically subsidized by the government at 60 cents on the dollar for people who are low income. So it doesn't look quite the same as if you're stateside, so to speak, but it is a new resource for people who are extremely low income in Puerto Rico, and there will be some private marketing options.
Thanks so much, Jen. The next question. I've heard that some people are exempt from the healthcare law. Who is exempt, and how can I get an exemption?
So the two biggest categories of
Oh. Lost him. I can answer that. Do you want me to start?
Sure.
Okay, I have a list right in front of me. So there's this individual payment, individual responsibility payment. Those that are exempted are those who have been uninsured for less than 3 months, those that have that can find that don't have any tax returns. So if you're not paying taxes, then you don't have to be part of this payment system. If you're from an Indian tribe, the Indian tribes were all exempted. And if you're part of a religious, I'm going to say religious group that is against Social Security, Medicare, you don't have to do that. If you're incarcerated, if you're in prison, you also won't be. If you're not lawfully present, you won't have to be paying this payment. And then there's the hardship exemption, which is what someone on the call talked about before. So, for example, if you're in the states that did not expand Medicaid, then you wouldn't have to be, and you were eligible for it, you wouldn't have to pay that payment. And then there's other hardship, such as having a death in the family, or if there's a natural disaster like big fires or the floods or the hurricanes. And then the other issues have to do with bankruptcies or being homeless, and even being a victim of domestic violence. These are all reasons why you could be exempted from paying the individual responsibility payment. If you don't buy insurance and you are qualified, you'll have to pay a payment on your income taxes for 2014.
So the one thing that I'll just say is make sure you don't try and make that decision yourself, saying, "Oh, I'm subject to a hardship. I had a fire in my community. I don't have to go purchase insurance." This is actually something that you will have to, hardship in particular, as well as the religious exemption, you will have to individually apply. And so that's one of the things that if you're thinking about needing an exemption, I would really encourage you to talk to someone who is associated with your marketplace to make sure that you can claim that exemption.
Thank you so much. Now as we're getting to the end of our time, I just want to take a moment to thank everybody for participating, for our panelists for joining us, and for everyone who's tuning in online as well. We have one last question that we're going to read off today, and that question is, how can I get involved in spreading the word about these changes?
Well, I think everyone has a part in, one, the responsibility in getting enrolled yourself, but also making sure that your family is enrolled. Again, it's really all about health that we're talking about. We have a couple of different ways to get involved with all of the partners here present. We're each rolling campaigns, both together and individually, that you can get engaged. As part of Enroll America, we're actually rolling out the Get Covered America campaign. So you can actually volunteer in some of these states that we were talking about, where the word needs to get out. Organizations like Planned Parenthood, Voto Latino, obviously, they're doing their part. So definitely find a way to get involved and really get the word out. Really make use of social media. We have the Get Covered hashtags, as well as pictures that you can change on Facebook to really make this thing go viral, so that everyone really understands and knows how, what the benefits are. And again, go to Cuidado de Salud and healthcare.gov to get informed, so you can inform your family and friends.
Great, thank you so much. Again, I just want to stress just our gratitude for everyone who submitted questions. These are real questions and real concerns that a lot of us have, and we appreciate you sharing those so that all of us can learn from them as well. If you have other questions that you didn't get a chance to get answered today, or that you still want to submit, please continue to send those. This Google Hangout is the first one of a series that we're going to do during this entire 6 months of open enrollment. And so if there wasn't a chance to get your question answered today, you'll have an opportunity again in the future. One way to stay up to date about our future Hangout dates is going to our website, latinosforhealthcare.com, and signing up for our updates there. You can sign up with your email and your phone number, and we'll text you updates so that you can get the link for the next Hangout right to your phone and make it as convenient as possible. Thank you again, everybody, for tuning in. The next Hangout will be the week of October 23rd, so again, sign up for those updates and we'll let you know the exact date. Thank you again to our panelists, and we'll hope you'll join us next time.
Thank you.
Thank you.
Thank you.